Ask most women what they dislike about their bodies and they'll probably give you a list. SCULPT Contemporary Cosmetic Surgery gives women the power to make changes on their own terms. Dr. Gerard Stanley returns to explain why breast augmentation is different at SCULPT. Good morning. Thanks for being here.
Thanks for inviting me. I appreciate it.
A topic a lot of people are interested in but might be a little embarrassed to talk about. You do this procedure at SCULPT a little bit differently than most people might expect. How do you do it?
Well, breast augmentation, the procedure, is really just about augmenting the chest to really give people more of a shape or more of a form back that they're happy with. The traditional procedure involves having general anesthetic where you have a tube put in your throat, you go to sleep, you wake up, and then you have to do all the general anesthesia recovery as well as the surgical recovery. We do the procedure a little bit slower, a little bit different, but we do it with patients wide awake under local anesthesia doing some regional nerve blocks.
So what does it feel like for the patients? Because that might make some of them nervous, but then some of them might like that idea of being really involved in the process and not having to be put under.
A lot of patients like the fact that they don't have to worry about the general anesthesia. That's the one thing that we always have folks coming in for, whether they're young or they're moms or they're at some place saying, you know, I'd really like to have this done, but I don't want that scary general anesthesia. I don't want that risk. So the procedure itself, most people come back at a week after the surgery and say, I can't believe how easy this was. I can't believe that 3 days after surgery I was on Tylenol. I can't believe that I'm up moving. I can't believe that I really didn't have any nausea or no downtime. I mean, there's still some discomfort because it's a surgery, but doing it a little bit slower, letting the anesthetic, letting the medicine do most of the work, it's a much more gentle, much nicer recovery for patients.
And what does it actually feel like? What do they experience?
Most people say it feels tight, like the skin is stretching, sort of like if you're taking a deep breath in and you hold that breath in, that's what people say it feels like on their chest. So patients don't really have any pain because we've blocked all the nerves, we're using a lot of numbing medicine, so it's a very comfortable procedure, but they'll say that it feels very tight in their chest.
So you brought in some examples today. They were talking about these
We brought
in the
in some
green room.
different examples, yes.
So these are the implants. How do you work with a patient to decide what size might be right for them?
Well, I always sort of tease my patients and say, think about how picky you are about your purses, how picky you are about your shoes. You should be twice that picky when it comes to choosing breasts. So we'll spend over an hour just trying on different sizes. We take a whole series of measurements where we really want to come up with what's the best implant for the patient's overall desire, but as well as something that's going to fit into their lifestyle. If they're a jogger, if they do Tough Mudders, if they're into CrossFit, if they're into different activities, we want to make sure that their lifestyle and their overall desire are going to work together.
Obviously, a lot of women, when they become moms, when they breastfeed, they don't have the bodies that they used to. Right. How can something like this affect them, make them feel better, and give them that look back that they once had?
A lot of women will come in and they'll say, I love my kids, but when I look in the mirror, it bothers me what my kids have taken away from me. So this really gives them a chance to have that harmony again, to say, yes, I feel more complete, a little bit more harmony in how their body feels, and say, I've got my pre-baby body back. I want to feel beautiful again. I want to feel sexy again. And it's not that they're not to start with, but they'll just feel like they've lost a little bit of something after breastfeeding or after having kids. And this really helps restore that contour, just the ratio, the proportions to their body that they're happy with.
And since you do this procedure under the local anesthesia, is there good and bad candidates?
Realistically, because we're doing it under the local anesthesia, there are more good candidates. Okay, when you're doing general anesthesia, there's more candidates that will fall out of the procedure to where you say you're not a good candidate or you're too high risk. With this, patients can come in, you do it all under local, they're awake, they're talking to you through the whole procedure. So actually, there's more good candidates doing it under local than doing it under general.
Taking a look at these is one thing, but we have some before and after pictures. Now, before we show these images, parts of them have been altered for modesty, but if you're at home, you have some kiddos in the room, now might be a good time to direct their attention elsewhere. Why don't you walk us through these pictures? Because I think seeing the way that a woman's chest changes, especially if you've had some of that drooping or stretching, there's a before image here, and then we're going to see the after image from the front.
This was a really, really nice gal who had 2 kids, and her big complaint was, I've never had a very large chest, but after having 2 kids, what I used to have is now completely gone. So she came in saying, I was an A cup, now I'm hardly an A cup. What can we do? So we sat down, took a lot of measurements, and really came up with her overall goal to come up with what's going to be her perfect augmentation strategy. And this is where she's at right now. I think these were 3 or 4 months after her procedure. Now she's a year out after her procedure. She couldn't be happier. She says everything's perfect. She just loves where she's at. So.
And that was a side view of the same patient there as well. You have more before and after pictures available in your office. So if people are interested, the best thing to do is to contact you, come in, talk about it, obviously, because some people this might be right for, some people this might be right for, and having that conversation, I would imagine, with you is a good place to figure out what the best option is, what's going to work with your lifestyle.
It's all about finding the perfect fit.
Special offer today for our viewers who might be interested in this. What are you doing for our viewers who might be interested in taking this step for themselves?
My manager said anybody who mentions the morning blend segment is going to get $500 off their breast augmentation procedure. So,
and how much does a procedure typically run, to let people know how big of a savings
the
this is?
procedures are about $5,400. So there's little fluctuations, but it's right around $5,400 for most patients. So it's a pretty good savings.
Well, in a good way. What's the major impact that people have after this? What does it do for their self-confidence?
I'm amazed at just how empowered people feel. People always ask me, what's the most beautiful thing you can be? And I always tell people it's really about that empowerment, that sense of, I own myself. Just there's something beautiful about confidence. And I think that's the one thing that people always get after these procedures, is that sense of confidence back.
All right, you can see the contact information there on the screen if you're interested in finding out more. You'll find SCULPT Contemporary Cosmetic Surgery near 132nd Center. Give them a call at 402-884-6700. Of course, go online, check out more information there, and give your office a call if you're interested in finding out more. Thank you so much for your time today.
I appreciate it. Thank you.
I can't stop playing with these. That's what they were doing in the green room. It's like a stress. I'm going to give those back to you.
Okay, we'll take these away.